Hello everyone, welcome to today's presentation. My name is Twaamba Chilema and today we're going to have a presentation on bad breath or halitosis. So bad breath is something that gets to affect quite a lot of people in society. And mind you, it gets to affect people mentally, both physically and mentally. People may not be able to express themselves fully because their breath is quite foul, and that would actually prevent them from participating fully and equally. Bad breath is characterized by a foul odor, or rather a bad odor that comes out from someone's mouth as they get to speak or just open their mouths. Firstly, before we can discuss the causes of bad breath, I want you to know to say bad breath can either be short-term or long-term. Medically, I would say bad breath could be either occasional or chronic, meaning one is of short-term and the other is something that's been happening over a long period of time. So for occasional or short-term bad breath, this is usually caused by lifestyle or certain habits that we get to do. For instance, if you get to chew garlic or onion, you're likely to have occasional bad breath. But when you have poor oral health hygiene or you have underlying ailments, you're likely to have chronic halitosis or chronic bad breath. So let's now go to the causes of bad breath. So one, which I always start with, poor oral health or poor oral hygiene. So if you do not brush your teeth at least twice in a day, you're likely to have bad breath or halitosis. So toothbrushing should be done at least twice in a day, preferably after meals. Secondly, if you have cavities in your mouth, that would allow food to lodge into your teeth and you, in turn, you're likely to have bad breath. If your gums are bleeding, you're equally likely to have bad breath. If you do not brush your tongue and the surrounding tissues in the mouth, you're equally likely to have bad breath. So poor oral hygiene is one of the major causes of bad breath. After that, we have other lifestyle habits such as tobacco use and excessive use of alcohol. Those two equally get to cause bad breath or halitosis in quite a number of people. And then thirdly, we'll come to the underlying ailments. People that get to have infections of the lungs and the respiratory tract are likely to have bad breath because that is where the air passage is. So if one happens to have such, they're likely to have bad breath. If you have issues to do with the tonsils, you're likely to have bad breath as well. Inasmuch as bad breath has quite a number of factors, it can be managed effectively. Firstly, you have to see the dentist. You need to make sure you go to the dentist, get your routine cleaning done at least twice in a year, which is over a period of 6 months. You need to see your dentist to have your scaling and polishing done so that the calculus, the stains, the plaque can be scraped off your teeth. Then secondly, if the halitosis or bad breath is coming from lifestyle habits such as smoking and excessive intake of alcohol, you might as well cut those bad habits so that the halitosis could disappear as well. So if the halitosis is as a result of underlying ailments such as respiratory tract diseases or diseases to do with the lungs or the airway passage, the tonsils, the throat, the stomach, you need to see a specialist so that they could find remedies for those ailments. That is the only way the halitosis or the bad breath is likely to disappear. But nonetheless, in as much as all these are caused by poor oral hygiene, underlying ailments, you as an individual as well can step up the game by using things such as a scented fluoridated toothpaste, a scented mouthwash, or some sugar-free gums, and always ensure that you stay hydrated, drink a lot of fluids so that you could stimulate the flow of saliva in the mouth, as this will keep the mouth clean, wet, and moist so that there's no food sticking in the mouth. So shisha, just like tobacco, is a scented form of tobacco that is given various flavors to give pleasure to the end users. But what you may all know is tobacco or shisha and any other forms of tobacco that are used are carcinogens, have carcinogens or agents that get to cause cancer. In as much as they do that, cigarette smoke itself gets to kill the taste buds. The smoke itself gets to stick inside the mouth as well. Just the same way we have different foods that get to leave different flavors in the mouth, even the tobacco smoke itself is able to stick to the surfaces in the oral cavity as well as go into the lungs. As you may know, tobacco has to be inhaled and exhaled. So that tobacco smoke gets to stick inside and is produced outside. So in the long run, you tend to have bad breath because of that. Thank you, everyone. Thank you for listening. If you have any questions, please feel free to follow us on Facebook, Twitter, TikTok, or please come through to Outer Dental Center and have your questions answered in person. Thank you.